Kung ikaw ang tatanungin, okay na ba yung 500 pesos na wage para sa mga mag-volunteer na doctors or nurses para i-screen yung mga COVID-19 patients sa outdoors or sa mga hospitals? Ito ang tanong. Sapat ba ang 500 pesos na allowance ng mga medical professional volunteers such as doctors, nurses, allied healthcare professionals, nurse assistants, and orderlies para mag-volunteer sa labas and sa mga hospital para mag-handle ng COVID-19 patients? Yun ang talagang may nagkaroon ng reaction sa mga doctors, nurses din, mga ibang healthcare professionals kasi masyadong mababa for a person who will be exposing her or himself sa mga highly risky, highly infectious na medical case or issue. Because, syempre, ang lakas ng infection level ng inyong novel coronavirus, ang tindi ng kanyang paghawa sa ibang tao. Kasi, kapag nag-atching ka, like, tatagal siya ng 3 hours, 30 minutes to 3 hours, correct me if I'm wrong. Kasi kapag dadapo siya sa metal, aabot siya ng days, 2 days, yung mga ganun, mga plastic, mga wood, ayan, mas matagal siya mamatay. Pero pag sa air kasi, maabot lang between 30 minutes to 3 hours. So, ang lakas talaga ng infection rate niya. Kaya, ngayon is ang Pilipinas na meron ng 800 plus, 803. Hindi ko alam kung baka mababago pa yan. And then, marami pang more than 40 plus ang talagang nasawi. And then, baka aakyat pa siya. And then, umaakyat na rin po ang mga nag-recover. And with this, we expect yung cases na tataas pa talaga because ang daming talagang nahahawa day by day, ang daming pasaway na alam nilang PUI na sila, na test na sila, lumalabas pa rin sila katulad ng mga iba dyan na punta sa matataong lugar talaga. And sa mga senaryong ito, kailangan talaga ng gobyerno ng additional manpower sa mga healthcare professionals like me. I'm a professional nurse. However, parang medyo ano pa ako dyan because naabutan ako ng COVID habang nag-a-apply ako for overseas para mag-work sa ibang, alam nyo na ang reason kung bakit, kasi syempre for greener pasture. Ang benefits naman ng pag-volunteer is, number 1 is to serve and protect the country from any threats such as yung threat ng COVID-19. Number 2 is, yan, syempre, become a role model para sa mga ibang tao dyan na despite from the risk, you are setting yourself as an inspiration na talagang persistent to make our country na i-lessen yung mga infection rate, to control the infection rate ng COVID. Ayan. Siyempre, yung compensation, number 3. Merong allowance na 500 pesos per month. I'm not sure kung within the 14-day or yung kasama na rin yung quarantine period na yon, basta 500 pesos yan. And then, number 4 is, pwede kang bigyan ng yung certificate of volunteerism, COE, ganon. Yun ang mga benefits ng pag-volunteer as a medical professional ngayong in times of health crisis. Kaya ipapakita ko sa inyo yung portal kung paano mag-apply as a volunteer medical professional sa DOH para at least ma-deploy ka sa mga hospitals na designated areas for you to handle COVID-19 patients. So, andito na po yung papakita ko sa inyo ngayon. Hello guys! So, andito tayo ngayon sa page ng Department of Health Philippines and ito yung isa sa mga post nila. Sabi dito, we are facing a formidable but beatable enemy. We need more healthcare warriors in the fight against COVID-19. We are looking for doctors, nurses, nurse assistants, and hospital orderlies who will heed the call to serve. Ganyan siya. Calling all healthcare warriors. Yan. And what will signing up involve? You will work in one of the 3 NCR COVID-19 referral hospitals, Lung Center, Philippine General Hospital, and Dr. Jose and Rodriguez Memorial Hospital. On-site accommodation will be provided by your 1-month stint. So, ito is kung mag-i-start ng March 27, for example, mag-i-end ng April 27 kasi 1 month siya. And how to apply? Ayan, mag-sign up lang. Sign up and answer survey. Wait for the DOH portal confirmation of participation. And then ito, attend orientation and training. Sign waiver and non-disclosure agreement. And number 5, get to work. Tapos, ito yung link. So, i-click natin yung link. Papunta na tayo dito sa form filling up na portion. Ayan. Buti naman medyo mabilis mag-load. Ayan. So, welcome to DOH Healthcare Warrior Portal. Ayan. Let's beat COVID-19. So, sabi dito, apply to be a healthcare warrior. Tapos, opportunities for nurses. Ayan. So, andito yung doctors, nurses, other medical professionals. Ito yung mga medtech, radtech. Ayan, yung mga occupational therapist, respiratory therapist. Ayan, nurse assistants. Tapos, mga orderlies. Ayan. And, punta tayo dito sa nurses. Kasi, syempre, nurse. I'm a nurse. So, titignan natin kung ano yung laman na andito. Ayan. Opportunities for nurses updated 2 hours ago. This opportunity is for licensed nurses who want to help in the fight against COVID-19. Work in time dedicated. You'll be assigned to one of the 3 COVID-19 referral hospitals. Yan, Lung Center, Philippine PGH, Rodriguez Memorial Hospital. You will undertake an 8-hour shift every day. You will work for 14 consecutive days in 1 month yon. I'm not sure. Once completed, you will do a mandatory on-site quarantine for 14 days. Think of it as a short holiday. This work will involve direct contact with COVID-19 patients. The hospitals will provide you with the personal protective equipment or PPE to help reduce risk of exposure. After this great contribution to your country, you may return home to your family. Yan, yung accommodation and food. This voluntary position is for 1 month. You will be provided with accommodation, yung allowance, 500 peso. Yan, tapos babayaran ka sa Paymaya. And yung insurance mo, kapag nahawaan ka, meron kang cash compensation of 100,000 pesos. Pero kapag ikaw ay nasawi sa COVID-19, meron kang 1 million health insurance. Ayan, so let's go to fill up the form. Wait for DOH Healthcare Warrior Portal. Wait for DOH Healthcare Warrior Portal. Yan, get to work. So let's go fill up the form. Ayan, so ganyan siya. And let's return to yung ganyan talaga yung itsura nito. So balik muna tayo sa face ko. Ngayon, nakita nyo na yung application online kung paano mag-volunteer as a healthcare professional. Parang, for me, ang dami kong tanong. Parang ang daming unclear, hindi clear na statements na nabasa ko. Kasi, number 1, medyo nalito ako sa 14 days na exposure mo. And then, yung 14 days na quarantine mo. Tapos, yung sinasabi na 1 month. I'm not sure kung babayaran yung buo or baka babayaran lang yung 14 days. Kaya medyo naging skeptical ako doon. I'm not sure kung tama tayo ng pagkakaintindi kasi hindi binanggit kung ano yung babayaran na days, kung yung ba 1 month or yung 14 days lang. Ayun lang. Hindi talaga siya clear. Tapos ang disadvantages lang kasi kapag mag-volunteer ka, you will be exposing yourself sa mga sa mga COVID-19 patients. Kapag may expose mo yung sarili mo, automatic after that maka-quarantine ka talaga for 14 days. Either maging PUI ka or baka ma-admit ka. Ayun, yun yung number 1. Yung number 2 na disadvantages is baka yung experience mong ito is i-affect na yung current na application mo overseas. Ayun, medyo seryoso yun kasi ibang-iba magtrato ang ibang lahi kapag magtatrabaho ka na overseas. Ibang-iba yung trato nila. And you must follow their culture and their laws. Kaya, yun yung isa, like me, na nag-apply sa overseas. Or greener pasture, of course. And then, yung kahit nasabi nilang 500 yung allowance mo, is this enough for a day? I mean, syempre, marami ka pang needs na dapat mong kunin. Lalong-lalo na, i-isolate ka sa ibang place, new place. Ayan. Kaya, I think, yung food is, I'm not sure. Syempre, sabi nila, shoulder nila yung food. But, shoulder nga, mangyayari nga ba talaga yung services na ganon kapag nandun ka sa area mismo? Ito yung panghuli na concern ko. Paano kapag na-infect ka na ng COVID-19 na virus or yung coronavirus, novel coronavirus? Syempre, nakasabi nila is they will cover 100% of all your expenses. Pero knowing Philippine setting, hindi, I'm sure merong pasegue yan. Meron at meron kasiguradong babayaran dyan. So, do not fully depend on government because syempre we understand Philippines is not that rich unlike sa mga first world countries. That's why meron at meron yan. Meron at merong may sabit talaga. And that's the reason why parang my final verdict is hindi na muna ako, I'm sorry to say, I'm not going to volunteer because ang daming risk. Tsaka ang daming kong questions about sa offer na yun. Although yung opportunity is yes, lalong-lalo na kapag hindi ako mag-apply overseas. Kasi syempre, experience yan, masasweldoan ka. Yun nga lang, may expose ka and apektado lang yung health mo. Ayan. So, that will be all. Sana, I'm sorry kung may baka magre-react dyan. Kung may na-offend man ako, I apologize. But this is my decision. Syempre, katawan ko to. Alam niyo naman, syempre, we have the right to decide whatever we think na makakabuti para sa ating sarili. And if you want more updates from me, don't forget to and subscribe my channel. And if you have more questions, just reach me out in my Facebook page, Instagram, and Twitter, The Star of Anthony. So that will be all. Thank you, and have a good day.